The Alexander County Board of Social Services is now called to order. At this time, I would like to ask Hazel Yoder to give the invocation, please.
Let us pray. Our Father, we ask for your guidance. We ask for discernment. We hope that you'll walk with us today as we make decisions that affect so many citizens in our county. Be with us. Amen.
Do I hear a motion to approve today's agenda as written?
Make a motion.
Second?
Second.
It's been moved in second. Do I hear a motion to approve the minutes of the March 26th meeting? A motion to accept it?
I'll make a motion to accept.
Second?
And second.
It's been moved in second. We will now hear the financial report from Sherry Deal, and it's for the month of March.
Good afternoon. Hope everyone's well. If you'll take a look at the report in front of you, this is for the month of March. And believe it or not, we're 9 months into our fiscal year. I don't know whether to yay or what. Where we are at this point in time in our budget year, we're 75% in. And with the exception of only one category, we are well below our range in expenditures. The one that I will bring your attention to is the general assistance, and that is our crisis intervention monies. I'm sure Matthew Reese will have an up-to-date amount of how much SIP money we have available. I think per the ledger, we roughly have about $52,000. And I just turned in invoices today, so I'm not really sure what that total stands, but that is the reason we have not completely finished that allocation. And so, excuse me, that is where that is the reason for that percentage. If you'll take a look down at the bottom, all of our revenues are coming in according to where we are in the fiscal year. The only ones that we actually do have the money, however, it didn't hit the ledger or our account for the county until April. We did have some more reimbursement for our Western Piedmont Council of Government areas such as in-home, nutrition, and adult daycare, as well as housing. So we do actually have more money. This was reimbursement for the month of February. It gets reported in the month of March. However, we didn't get that reimbursement until April 2nd. So that will show up in the next month's report. And then if you'll take a look down at the bottom, the projected county dollars, as you can see, is $1.962 million. That translates into approximately $164,000 a month that we would have available to spend monthly throughout our fiscal year. We currently have spent approximately $135,000, so we continue to still be under budget for the year. Right now, we currently have a balance left at the end of March of $747,395, which, if we were to spend that full allotment, would be roughly $250,000. We do not anticipate to spend that, even though foster care expenditures have increased in the last couple of months, but we still are under our budget and predict to close out the year that way. And I'll be glad to take any questions you may have. Okay, thank you.
Thank you, Sherry.
I don't care.
We will now hear highlights of the statistical report from DSS supervisors.
Good afternoon, ladies and gentlemen. My name is Matt Reese. I'm one of the Economic Services Supervisors. If I may draw your attention on page 1 of the statistical report, just wanted to give a brief update on the food and nutrition section. In the month of March, we had 2,783 households, 6,240 individuals, the agency's seen 42 new applications and 96 reapplications. The total value of the food and nutrition units, $711,136, with an average value per household of $256. What I also wanted to bring to the board's attention is I've been in conjunction with the Second Harvest Food Bank. I don't know if any of you have seen in the paper where they put the flyers or the advertisements for a community forum that they have. They schedule those every quarter. I've been in active attendance with those and have learned from the representative of our region out of Winston-Salem that they are in the process of trying to bridge a gap with the food and nutrition household to the number of citizens in our county that may be potentially eligible for food and nutrition benefits. Unfortunately, they are working with old data. They are working with the year 2000 census data. The state, along with Second Harvest Food Bank, is aware that they are working with old data, and they're trying to get the new data as updated as soon as possible. But for our county, based on 2000 census data, the population, which is for individuals for whom poverty status is determined, was 36,212. And it showed that there was individuals eligible for food assistance, which means their income being below 150% of the federal poverty level is 9,365. Currently, or as of January of 2012, according to our data, we have 6,347 individuals receiving food assistance with a participation rate of about 67%. So with the 2000 data, year data being the individuals that would be eligible, 9,365, with this being now 2012, those numbers could be drastically higher. So in an effort to try to bridge that gap, one effort that they are doing is on the second and fourth Tuesday, there will be somebody at the Christian Crisis Center through Second Harvest Food Bank to try to connect people as they come into the Christian Crisis Center to see if they are actively on food assistance, and if not, to try to get the appropriate paperwork to them to get them connected with that program. So I just wanted to bring that to the board's attention, that they are trying to try to connect people with with various resources that are in the community.
Matt, are they also, there's a center in Stony Point where people get assistance? I don't know if there's one on the western side of the county or not, but there are a lot of folks go through the one there at Stony Point.
Yes, they do. And a new program has come up and is open, and it's the Hidnite Helpers. And they are in the old Hidnite Volunteer Fire Department building. And I remember, I don't know if you, ladies and gentlemen, remember a couple months ago I gave a resource. It was a horizontal or a landscape orientation. I've since updated that, and I need to get that to Shelley to where she could get that out to you guys and have updated to include the Hidnite Helpers.
Wonderful. Matt, you did a wonderful job with that before. You mentioned Second Harvest. Jan Jones of Second Harvest spoke to our Rotary Club just last week and did a phenomenal job.
Yes.
But it was, I think, stunning to the entire group to hear that 1 out of every 3 children in our county is food insecure.
Mm-hmm. Mm-hmm.
That, I think, really
Brought it
crystallized
home.
that thought and brought it home.
Yeah.
Absolutely.
Yeah.
But good, your report was just wonderful last time, so we'll look forward to the update.
Well, thank you. Thank you. Is there any other questions that anyone else has? Unfortunately, I know Ms. Deal had mentioned about the SIP. Unfortunately, I was not prepared to bring the balance, of those funds. I will be happy to also get that to Shelley. If you ladies and gentlemen are interested in that, I can get that to you as soon as possible.
Okay,
Okay?
that would be fine.
All right.
Okay, thank you.
Thank you.
We are extremely fortunate, aren't we, Matt, that we had this cold snap, that we still do have some crisis intervention
Yes.
money on hand.
I do
been
know
busy.
and can speak on that. It has been busy. We have still continued to see an increased number of individuals. I don't really feel comfortable giving a general number. I was sitting there whenever I heard Ms. Dill say that, really don't feel comfortable giving an average number because I know in the past couple days, my intake worker that administers that program has seen a great deal of number of people into her office. So, but I will get that information to Shelley and she can forward that on to you guys. Thank you.
Thank you, Matt.
Good afternoon. I'm Trina Riddle, and I do the Family and Children's Medicaid, Daycare, and Work First. And I just wanted to have you look on page 2 under the daycare services. Since July, you can see that our number of children served has increased. It's actually increased 138 children. We also have an increase in expenditures of $33,961. We don't have a waiting list anymore, so we've gotten all of our children off the waiting list and are now serving them. And so therefore, when people are coming in, we can just serve them directly as they come in the door. We also have increased our spending to almost 100%, and we received an additional $55,694 in April for daycare. So I wanted to let you know why there's such a big difference in the numbers. But we have been working our waiting list, and we a lot of those children were the 10 to 12-year-olds, and, we weren't assisting them last summer. So we now have everybody off the list, and everybody that's coming in the door, we're helping them as they come in. I also wanted you to look at the emergency assistance right above that, the AFDCEA. And you notice in March, we helped 22 families, which is a huge jump from the prior months. We did take out our temperature requirement where it had to be below 40 for 3 consecutive days because we had so much money left where it's been so warm, and we were turning people away. So I talked to Cindy, and we decided to take out the temperature. And so we've been spending a lot of that money now, and we still have around $8,500 left. And like Matthew said, Becky's been very busy between EA and CIP. They've been keeping her busy. Do you have any questions about either one of those programs?
No.
Thank you.
We have if that's all of the supervisors.
Well, good afternoon. I'm Holly Young, the Children's Services Program Manager at DSS. And if you will turn to page 4, I believe. I'm sorry. I got lost waiting for somebody else to come to the mic. Page 5. You will see the statistical information for the Child Protective Services Unit for the month of March. And you will see that we received 96 reports in the month of March. We accepted 60 of those reports for investigation or assessment and screened out 11. I won't go through each and every one of those numbers with you, just the highlights. We also had 64 investigations open on the last day of the month and 46 in-home cases open on the last day of the month. We had 4 children to enter DSS custody in the month of March, bringing our total number of children into custody to 46. And you can see below that 46 the various locations in which those children are placed, being licensed foster homes or kinship homes, group homes, etc. We have 3 children that we're monitoring in guardianship or custody placements. And I was looking to see. We had 2 families approved for adoption, and we currently have the potential between the end of this fiscal year and next fiscal year to have 15 children in our county adopted, and we're very excited about that. So we're hoping by the end of the fiscal year of 2013, in the June 30th of 2013, that we will have accomplished that or met that goal of those 15 children having permanent homes. So we're very excited about that prospect. And if you also have in front of you a report that's titled Child Protective Services Investigative and Family Assessments, and that's a breakdown of the reports that we received in the month of March. usually the thing that we talk about the most is the backside of that page, page 2, and the number of reports involving particularly substance abuse and domestic violence. You'll see that we had 73% of the reports that we were involved in involved some type of injurious environment, and we've talked about that before, being a substance abuse, domestic violence, usually type-related situation, and that 50% of the cases that we were involved in involved substance abusing parents or an allegation of substance abuse, and 38% of the cases we were involved improper supervision. And I'll be glad to answer any questions that you have about that.
I just want to say once again how much our church enjoyed having you and Cindy do the presentation that you did on Sunday. I think that caused more stir than any single presentation in a long time. A lot of interest. It was clear you presented it for the board. It was the one we viewed maybe 3 months ago. But it really brought that home too, so thank you.
And I know CD has that on her agenda, I think, to talk about that a little later on, so I won't steal her thunder on that. But we were very appreciative to be invited to come to First Baptist Church and talk about the need for foster parents in our county. And we hope to be able to recruit some families from First Baptist Church and other areas of the county as well. We currently have 19 licensed foster homes in the county, and we would like to have a lot more. It would be nice to have a foster home for every child that we have in foster care. More foster homes than we have children, I think, would be our goal, and hopefully someday we'll reach that, and in every area of the community. So we look forward to going out and speaking with any group that's interested in hearing about fostering or how to become foster parents. There is an information session scheduled for people who are interested in becoming foster parents on May the 7th at 6 o'clock, and that is at DSS. So anyone that's, listening today or sees this presentation in the future, we will be holding an information session on May the 7th at 6 o'clock.
And if you want to give Tennille's, I don't know if you know her extension right off the top of your head, but the main agency line, Tennille Heilman, is our licensing social worker, and folks could contact her if they wanted more information before just coming to an information.
Tennille's phone number is 828-632-1080, and her extension is 347. I have to count offices and count backwards to remember extension numbers.
I do, Holly, while you're up here, want to put this in perspective just a little bit. When you look at these numbers, you know that we've come forward this last year and talked with you quite a bit about turnover, and we had to have some staff. Even with our new staff, we have 2 vacancies right now, which is coming up in my part of the presentation also. But we have 2 investigator assessment positions vacant right now. And when you look at these numbers for March, 60 reports accepted. A caseload, according to standard, for a investigative social worker is 10. With 2 vacancies, we have 3 workers. So without considering new information on open investigation, assist from other counties, outreach, any of that kind of thing, you can see that with 60 reports accepted for 3 workers, that would be double the standard across those 3 workers. So we certainly are hoping, we have job vacancies posted and are hoping to do everything we can. Applications are not pouring in, but we are hoping to get some folks hired. But it's very stressful for our staff. As Holly talked about, the numbers of 73% with substance abuse or environment injurious and 50% substance abuse users. The cases are really complex, very difficult, and it's a tough time for our child welfare staff. So we just wanted to make sure that you know what kind of shape we are in the child welfare area right now. Struggling a little bit.
Mm-hmm. And Shelley is always great about doing so many things and doesn't get recognition for a lot of things that she did. But in talking with her, she has done some research about vacancies in surrounding counties to see what our competition is.
and there's competition out there. There are other agencies that are struggling in child welfare just like we are to maintain staff. And those other agencies that surround us tend to pay a little bit more than we do, but we're hopeful with some new graduates coming out of school with the Child Welfare Collaborative and that program that we may get some really good applicants during this time period that we have our application deadline open. So we're really hopeful for that. Any other questions or comments?
No questions or comments, but I did see on the TV about Iredale. Did you see the one that they were talking about? They needed foster care and everything, and I thought about us.
I think they have 200 plus kids in foster care. I don't remember the exact number, but yes,
I did.
It was a lot, yes.
Yeah, it was. Of course, they're bigger than us too, aren't they?
Yes, much bigger.
Okay, that's it.
Thank you.
Holly.
I'm just going to stand here instead of sitting down and coming back since I'm the next person on the agenda as well, if that's okay. I just want to talk to you just briefly about activities for Child Abuse Prevention Month. If you don't know or are not aware, April is Child Abuse Prevention Month, and I did give each of you a bookmark in honor of that, but wanted to talk about an activity that we were able to participate in that was kind of impromptu for us. Our Relay for Life team at DSS was nice enough to allow us to set up a table at their Relay for Life event in the park day, and that was on April the 14th. And we sat up a table and we took pictures of kids, well in excess of 100 photos of children, and sent home make-it-yourself photo frames for those children as an activity that they could do with their parents. And we had a blast just meeting folks and giving them information about child abuse and neglect and how to deal with a difficult child and temper tantrums and those things that sometimes are a trigger for neglect type issues. We also had a cornhole game that was set up beside of our table, and those boards were busy the whole time we were there. 2 of our staff helped. They bought their own door prizes and handed them out for the kids as they, whoever won. The kids absolutely loved it, and we really had a good time because we aren't associated with Child Protective Services knocking on the door, bad guy. At that point in time, we're just in the community watching families and working with families and talking to families. And I think all of my staff that participated in that event we really enjoyed meeting families and talking with them. We also had several staff to donate items to put into a basket that was filled with all kinds of things that families can do together. In the name of playing for prevention, which has been the theme for Child Abuse Prevention Month for the past couple of years. We had baseballs, baseball bat, other balls, crayons, markers, Play-Doh, coloring books, you name it, it was in there. And so we did a free raffle with that and just gave raffle tickets out to those folks that visited our table. And so we were able to donate that basket to a family with some information in it that encourages them to play with their children and how important and playing and building that bond with your children is. So that was a very fun event for us. We also are planning on participating with the Family Infant Preschool Program in observation of Child Mental Health Month and plan to do some Child Abuse Prevention Month activities with them when they hold that activity at their agency, as well as the Alexander County Partnerships for Children, their day in the park. We plan on participating in that as well, and so we're just going to keep on carrying our Child Abuse Prevention Month theme on a little longer than just for the month of April. And if you've not already received an invitation, you should be receiving an invitation shortly for our foster parent picnic on May the 3rd. If you've never been able to attend that event, it is always lots of fun. Our staff do a great job of planning and working with the families that attend that, and I would encourage each and every one of you to attend that. So we move from Child Abuse Prevention Month into May, which is Foster Parent Appreciation Month, and so we hope that each of you will be able to attend that event. Thank you.
Thank you, Holly.
Good afternoon. I'm Rob Young. I'm the agency attorney, and Cindy has asked that I present a little bit of a program about what the responsibilities of the agency attorney typically would be. What I'm intending to cover in just a few moments is a few of the aspects of that representation. I'm going to start with the areas of the representation, what I do for my client, which is the Department of Social Services, the qualifications of a DSS attorney, and then I'm going to highlight some of the particular areas that I provide representation for the agency. In terms of the representation, I've been with Alexander County since 2004. Before that, I was with Iredell County for 5 years, and before that, I was in private practice. The areas of representation, strangely enough, aren't. It's not too far different from a general practice that I had experienced. I represent, in the whole, a lot of general agency matters. A lot of discussion about confidentiality that comes up in various and sundry aspects. There's some representation that relates to personnel. The big areas, however, are in the three divisions. Two other divisions of the agency. One is child support, and one is child welfare. I also provide representation to adult services. To a much lesser extent, but nonetheless do, and every once in a while in the income maintenance sections as an issue may arise. Also, there's appellate representation, and last but not least, there's some training that's involved from time to time. With regard to the qualifications, it's an odd job. Typically, when a person, for instance, when you go out of law school, you can jump into just about any area of the law. If you want to be an assistant district attorney, you can just basically wipe the wetness from behind your ear and march on in and start prosecuting cases. With a DSS attorney, it's a little different. It does require the obtaining of a law degree, but generally speaking, 2 years of experience is required before you can go into this. And there's good reason for that, because although there's a lot of general aspects to the job, it's nonetheless a specialization. There are very narrow areas that involve specific knowledge that you have to have. You have to have that platform of general experience, but you also have to have the specialization, and you really can't get to that specialization until you've got the general experience. So 2 years is typically what's required for this particular position. It's not considered a specialization in under the rubric of the North Carolina State Bar, except in conjunction with an organization called the National Association for Counsel for Children, which does offer a specialization. And I am one of the specialists in North Carolina. There are maybe 10 of us in the state. With respect to the particular areas, I'll just briefly cover some of the areas that I've related before and what I do in those particular areas. With regard to agency matters, a whole host of things come up. You never know what. You wake up in the morning and you never know what's going to come through the door. It can be just about anything. But a lot of times issues relate to policy. What do we have to do in order to have this happen at the agency? What should we have? What should we have happening at the agency? What should we not be doing? That sort of issues. As you're aware, sometimes on occasion there are issues involving litigation, whether it relates to the county or the Department of Social Services, and I'll assist in that. It doesn't happen every day, but it does pop up from time to time and requires my attention. Compliance and confidentiality matters, I'll cover in just a second. And occasionally there's some personnel consultations that arise that require assistance. On confidentiality, there's one of the big areas that we have I don't want to say daily, but weekly, is in the area of our record as it is developed pursuant to child welfare investigations. We have an obligation to keep that record strictly confidential. Nonetheless, we are besieged with subpoenas for our workers to appear, not just in this county, but in all the surrounding counties. And we've had subpoenas from as far as Nebraska. I had one from Florida. Now, certainly the social workers don't have to travel there. They're just looking for the record, but that does require a response, and that has to be met. Also, all of the things that we collect, all that data that we collect about recipients is to be confidential. 108A and the general statutes require that there not be disclosure of data that's collected. If you receive benefits, that's a confidential matter, and we have to protect that. I serve as the HIPAA compliance officer. We have part of the agency that falls under HIPAA, and to the extent that that requirement is imposed, we have to maintain certain standards of compliance. I keep an eye on that. Another area that comes up is the substance abuse confidentiality. We don't so much need to protect the confidentiality. I want to rephrase that. We have an obligation to maintain confidentiality with regard to substance abuse, but more often than not, we're seeking information about that because of our clientele. And there's a little bit of a dance that you have to go through with various hospitals and other entities, and I have to work that out with them. Unfortunately, I'm on one person's speed dial for Fry Hospital almost always, and he just says, "Hey, it's," and so yeah, I know, okay, bye. We don't even complete our sentences. We know what it's about, and as soon as I hear his voice, I know what he's going to say, and he knows what I'm going to say. It's a good working relationship. In terms of child support, that representation is both in-house and out and in the courtroom. I meet with the workers every day. Come around in the morning. There's always something that needs to be signed. Speak with them about matters that might arise. But the thrust of the representation takes place in court. We do establishment, we do enforcement, and we have a mixed term. It's a little unique in most of the areas that I have been in. They usually do either establishment or enforcement on a given day. They don't do it both. Our record, I think, demonstrates that it's been a very good, successful formula. In Iredell County, we would have as many as one time 650 enforcement cases because we only did it once a month. And that keeps you in the courtroom till about 7 o'clock. We get out in a timely fashion. We process very large amounts of cases, and we do it, I think, in a very efficient manner. So it's worked and continues to work. But we do both of those things on a weekly basis. In terms of the enforcement or establishment, we do paternity establishment. We also do child support establishment. Enforcement, show cause actions, we implement liens, performance bonds, license revocations, everything from fishing licenses to, I don't think we've ever taken a doctor's license yet. No. No, not yet. We have dealt with doctors, but we have not taken a license. That's to be, hopefully we won't ever have to have that. And then we also have interstate issues that arise from other states that are seeking enforcement from us. On the child welfare side of things, again, it's both in-house and out-of-house. We staff every Monday, and talk about usually the hot topics right off the beginning, and then we go over other things that are less hot, less critical, but nonetheless important. Every other week we have child welfare court, in which we will try one of two types of actions. We will have abuse, neglect, dependency petitions that will go on that day. We also have termination of parental rights actions. Those petitions, once they've been adjudicated, they'll flow into reviews and permanency planning reviews, and we'll conduct those. In between all of that, as an investigator is needing assistance, or if it comes up at staffing, I'll assist in that respect. If it doesn't, I'll still come up with it. Very frequently, a lot of my involvement is, what do you need in order to, here's the stuff I've got. Here's what I can't get. let's work out, I need help on how to work out getting the evidence here that we know is there based on circumstances. And we'll work out an appropriate strategy and go from there. Adult services, basically as is needed, consultation, and that it's not as frequent, but it does occur. And then when we do go to court, it's before the clerk as opposed to other venues. That's basically confined to incompetency petitions and guardianship. We haven't had so much of it here. I had a lot of it in Iredell County. When we have guardianship, sometimes we have to liquidate property. That can involve selling property literally on the courthouse steps. Fortunately, haven't had to have that here. I don't relish the day when we have to return to that. It's not a pleasant undertaking. The final two areas, I'll just highlight very briefly. I also do appellate representation of the agency as a case arises. We've had ups and downs. We have brought cases to the Court of Appeals. We've brought a case to the Supreme Court. We've argued there. We also defend them, and it looks like we've got one in the pipe, maybe two. So we're getting out that material again to write another set of briefs. The final thing that I undertake and is the responsibility of the agency attorney is that area of training. I do staff trainings. I do trainings involving the area bar. Last year did trainings in the area of child support enforcement and juvenile review. This year doing one on termination of parental rights cases, and the 22nd Judicial District is doing one on sort of I don't know how to characterize it, but can we all get along is kind of the theme of how the various actors in the court system need to appreciate one another's role. And they've asked all the Department of Social Services attorneys to serve on a panel. I think Cindy's serving on a panel, both representatives from this agency and also Iredell County. So in a nutshell, that is what the Department of Social Services attorney does from day to day, minute to minute. And if you have any questions, I'll be happy to answer them.
I don't. I think you did a great job of explaining it. Thank you so much.
Thank you very much.
Thank you.
If there are no other reports at this time, then we'll hear from the director, Cindy Hillman.
And I do appreciate Rob making a presentation, and just want to say that he does a really good job for our agency. Having worked in multiple DSS agencies and worked with a number of staff attorneys, I will tell you that he gives our staff a lot of time. There are counties where you are not able to staff with your attorney. They don't go into court without knowing, having staffed very carefully. So we're prepared for court, and Rob's a big part of that. And he does. We beat him to death sometimes with our child welfare cases. We don't always agree, and he tolerates that well. We go kind of policy and law kind of go like this sometimes, and he does a great job for us, and I really do appreciate him. I told you a minute ago, I'll be real brief. The agency vacancies, we do have 2 investigative assessment positions vacant right now. We're very disappointed to lose the 2 folks that we've lost. And we have also lost a child support agent. We have promoted from within our program. We had already a child support office assistant who we have promoted to agent, and we have it's posted.
Carol's getting ready to start.
We're getting ready to, okay.
Getting ready to interview.
Okay. So we have 3 vacancies currently. I believe Shelley has already distributed to you. I wanted you to see the letter that we discussed at our budget meeting about just, making points about the budget. And I have given you a copy of that. And if you have any questions about that, you may want to take some time to read it afterwards. But if you'd like to contact me, or if you have any concerns about the letter, I did try to make all of the points that you indicated to me in our meeting, in that letter. We wanted to let you know also that our two, what we call, they're called the super users in our food nutrition services program, are actually going to training now in NC Fast. So while we still laugh and call it NC Slow and question whether it's really coming, we want to believe now that we are going to move into some automation with NC Fast, and we're excited about that. We feel like it will help us with processing our work. And just the last thing about the presentation, I think it's been talked about by Holly already. Did want you to know that the young lady, the reason we actually went to the First Baptist Church, Kirsty Branton, was a senior who did her senior project this year on, I think she started out with possibly kind of not a negative, but some concern about how foster parents affect the lives of foster children. And in the midst of her project, that took a turn to her wanting to do something to encourage folks to foster and make sure that children's lives are positively affected by foster parents. So she did a country store and a breakfast at the church, and I think, the congregation supported her very strongly. A lot of our staff supported and went and participated and enjoyed that. My husband and I racked up on books. We took a load of books out of there. But she was able to raise $800.50, and she did present that to us. She gave that to our agency in memory of Karen Hoyle, our former director who passed. And Karen's husband and daughter and her grandbaby, her granddaughter, was there Sunday to actually receive that check, and then, of course, did pass it to our agency. But it came in at everything seems to have a purpose. There is a promotion, a focus in our county right now by the Partnership for Children on fighting childhood obesity. And of course, you've seen our playground at our office, I think. All of you have. And it kind of could use a facelift a little bit. And we've asked the partnership to come in and assess our playground. They're trying to do naturalized playgrounds and to do some things to make sure children are real active. So they're going to take a look at our little visitation area there, and that is where most of our foster care visits, if it's not below freezing outside, children want to be outside. So our visits take place out there in the play area. And so we will use that funding to do some good work to kind of give that area a little facelift. And that's all I have, Barbara. I don't know if anybody has any questions about the letter, or you can get back to me with that.
Thank you so much, Cindy. I missed the program at First Baptist, but it looks like you did a great job. So, and I know Hazel's church was glad to have.
Oh, absolutely.
Yeah. Are there any other items from anybody or from the board? Do anybody have any comments?
I just had a few things for staff going on in the community. Matt Cooksey from Habitat for Humanity did an early over at Lowe's in Hickory, did some training for women only. 2.5 dozen or so of us went over, and now after that training, we absolutely know the difference between a hammer and a nail. But there's a special event coming up for the community, and that's Women's Build. That is just for women, just a Saturday on May 12th, and it will be a wonderful opportunity for us to get together and to really put our new knowledge to work. But anyone who's interested in joining that, the contact number is 635-7889. Again, 635-7889. I'm so glad they're in our community. They've made a difference to so many people. Another organization I'll leave here and get to their board meeting is our local Lions Club, and we are really working hard to bridge the gap between those who need glasses, who need vision exams, etc., and those The change in federal funding, federal and state funding recently has hit so many people. And we're absolutely, is it all right to plug our Chick-fil-A? That, I guess not. But if you're hungry for chicken and want to support the Lions Club, let me know and I'll tell you the details.
We'll
What are
post.
you talking about, Hazel, as far as Chick-fil-A?
The Chick-fil-A
Yeah.
selling that I can't
fundraiser?
talk about. Yes.
For-
yes, the Lions Club for
Okay,
glasses.
okay.
That's what I can't
Okay,
say.
I was just curious.
Can I say
Send me a fax so we can sign up for it.
Yes, I do. I have sign-ups too.
What day and what time?
May 12th, all day.
Okay.
Okay. May 18th, sorry, May 18th, all day.
Your flyer says May 16th.
Oh,
Is
then
that-
that must be what it is. I will.
Leftovers on the 18th.
That's right, that's right.
Are there any other comments from the gentlemen? They've been quiet today.
They have been. We didn't give them an opportunity.
That's right.
We've been crowing enough. Both of us are going to be grandfathers this year.
That's right.
Okay. Let's hear it for the grandfather.
Okay.
Well, hang around a while, we can talk.
A couple months, we'll show pictures.
The next meeting, if there's no other information or anything, the next meeting will be May the 21st at 4 o'clock at CVCC Center. And do I get a motion to adjourn?
So move.
Do I get a second?
Second.
Move and adjourn. Thank you.